Hinder Peterson is a nurse at Sinai Hospital. When LifeBridge Health offered antibody testing, she jumped at the opportunity.
I got my results back. I was negative, and I was thrilled because it means what they're doing is protecting us, and that's great because we've taken care of so many positive patients that it means I haven't had it.
Dr. Diana Malavi is the chief of pathology and medical laboratory director at Sinai Hospital. She says they did a large study to make sure the testing was accurate before they opened it up to all staff members.
We've had a huge response. Yeah, we actually had to roll it out by birth month because we didn't want to get swamped with people on the first day. So the first day, only those born in January could get a test. And we've had a couple hundred a day get their blood drawn.
So far, the testing has revealed a low incidence of infection at LifeBridge.
Approximately 2% of all the staff that did not get sick, we're hoping that they might have had an asymptomatic case of COVID-19. Only about 2% of those people actually have the antibody.
While that shows the hospital is doing all it can to protect employees, Dr. Malavi was looking for a different result.
It's a little bit disappointing, I guess, in that we hoped we'd have a lot more people who were already exposed.
For the most part, the testing has had a calming effect on staff members.
We've started wearing N95s in every room now. We wear a shield in every room. If we have a positive or somebody under investigation, we wear a gown as well. But we've been offered the proper PPE, and like I said, by the results of the test, it's working, and that's a great thing.
And doctors say the data collected is invaluable.
If we had an employee that came down with COVID-19 in the future, and we had a history of them having the antibody now, that would be really important information. That would tell us that we don't get immunity from this.
So far, LifeBridge has tested 1,800 employees. In Northwest Baltimore, Lisa Robinson, WBAL, TV 11 News.